Coming up today, a reunion with an old friend leads to a new treatment option for one woman. Plus, how this second opinion sparked a special surprise from a familiar face with a familiar disease. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Call it the positive power of social media. When Jill Shahan reached out to an old classmate just to ask what she's been up to for the past couple of decades, the answer changed her life and her treatment plan.
We just kind of ran with all the same kids throughout high school.
That was 20 years ago.
I didn't have her phone number anymore, so I sent her a message on Facebook Messenger.
Which is a miracle I got it, because if anybody will tell you, I am like horrible on social media.
Jill, who had just received devastating news the day before, was curious what her old friend was up to.
Hello.
These days, Jamie Wagner is Dr. Wagner, breast surgical oncologist at the University of Kansas Cancer Center.
So it was truly, honestly, it was a God moment. And she says I was just diagnosed with breast cancer.
Triple negative breast cancer.
And I said, you need to come here. It was immediate.
Jamie and her team took on Jill, who ultimately needed a double mastectomy, radiation, and rounds of chemotherapy. It all went as planned.
Great outcomes from the chemotherapy is another part of her assessment, so just so optimistic about her future.
A future that included a special invite to throw out the ceremonial first pass at the Kansas City Chiefs' crucial catch game, the NFL's initiative inspiring fans to keep up with cancer screenings for early detection. And there was more.
And would be honored if you would do the ceremonial first pass at the pregame on the field. And I have one other little surprise, which might be my most exciting part of this whole thing, just letting you know. We have some very special guests. Chiefs defensive tackles, Chris Jones and Mike Pennel.
Oh my God.
You know, we heard about your story and what a warrior you've been.
Mike Pennel shared his personal connection.
When I was 2 years old, I was diagnosed with Wilms tumor cancer to where, I went through chemotherapy. They had to take, partial of one of my kidneys. I was fortunate enough to be in remission ever since that point. And as I was a child, I didn't really have too many memories of it because it was such a traumatic experience at a young age.
Both Mike and Chris inspire on and off the field.
I am truly humbled that the Kansas City Chiefs, as well as the NFL, will use their platform to bring awareness to changing lives.
And the feeling is mutual.
Miss Jamie here, the childhood friend who went in there and got that thing out. We're grateful for individuals like you who dedicate your life to help and save others. I mean, it's just, that's actually crazy that you guys were childhood friends. It's crazy how life comes full circle like that, and very thankful for that.
And Jill Shahan joins us in studio this morning with her friend, Jamie. Of course, around here we call her Dr. Jamie Wagner. She's the Division Director of Breast Surgical Oncology and Director of Breast Program here at the University of Kansas Cancer Center. Hey, friends. How are you?
Great. How are you?
Good. I love this full circle moment. This is such a fun story. What's it been like just being reunited?
It's great.
It's been fantastic.
Has it really been that long?
Oh, yeah.
Yeah.
What memory do you have from the last time you saw each other from 2 decades ago?
I'm not even sure when it was. We tried to talk about that last time, and it was like, I can't even remember when it really was, what the last...
Yeah. I do remember it was, we were at a football game. I think that was last time, like a homecoming football game, maybe a year or two after we were in college.
That's probably...
Yeah.
So it's been a minute or two.
It's been a hot minute.
So was this completely out of the blue when you get this social media message?
Oh, yeah, without a doubt. And as I had mentioned, I think that it showed in the video, it's not just that somebody sent it to me, that I actually got it.
And you don't seem like a big social media scroller.
I'm not.
So, Jill, take us back. Take us back to the day that you were told the news that you had breast cancer. You were at your community hospital. That's where you had initially started for some of those immediate questions, right?
I was in Columbia, Missouri. Yeah. I had found a lump in the end of November, and I knew it was I had no family history, so I wasn't worried about it, and had my annual exam in January, and that's when we did the mammogram, and it went from a mammogram to an ultrasound to the biopsy that day.
So you were doing self breast checks.
Yeah.
Good. And you were getting regular mammograms.
No.
You were not.
No,
I saw you look at Dr. Wagner.
No, that was my first one. Well, my doctor had said we have zero family history. There was no issues and concerns or anything up till that point, and they had just backdated it to like 35 at that point. And I hadn't had anything. She thought I'd be fine till 45. Apparently not.
Apparently not. Okay, so what made you reach out to Jamie?
Honestly, my sister was like, "Why don't you reach out to Jamie?" And I said, "Oh yeah, she does that."
So yeah, what had you heard? You'd lost touch over time, but you'd heard she had something to do with breast cancer,
I think
breast health?
One of my sister's friends had had a breast surgery, and she lives here in Kansas City, and had reached out to Jamie as well. So that's how I knew she was doing breast surgery and all that stuff.
So you get this message on Facebook, and I know your wheels are spinning. You're trying to figure out, okay, how do I jump into action? It's nighttime, and you're like, okay, how can I get her in here? But this is a different approach, because normally these are conversations that you have with people in a clinic setting. Maybe you haven't met them before. So how did you approach this? How did you get her here? What was that conversation like?
Well, anybody that works with me, especially within our breast program, will tell you I have a very maternal instinct and approach to everything with the breast program. So I think that went to hyperdrive when I got her text, and it was first like, "Hi, how are you? What's going on? I just found I have breast cancer." So then my next question, of course, was, "Well, do you know what type of breast cancer?" And she said, "They told me it's a triple negative breast cancer." Then immediately I just said, "Jill, we need to get you here. I want to do some additional work up here. Just want to make sure she's getting the right treatment." And we know what the power of second opinions are, especially at NCI Designated Cancer Center. There's national data. We even have our local data on at least 43% of breast cancer patients who get a second opinion at NCI Designated Cancer Center are going to have a change in their diagnosis and treatment plan. And for me, I just had to make sure that she was getting the right treatment.
When you heard triple negative, what did that tell you? What does that mean?
Well, from a triple negative standpoint, when we look at the prognostic markers, or as I explained to patients, it's like the personality type of your breast cancer. And breast cancer is now treated really tailored towards that personality type so that we can right-size treatment. We have a lot of tailored therapies. The great thing is if you get those right therapies, and even the sequence of the different types of therapies that you need, patient outcomes can be absolutely fantastic. And triple negative is an aggressive type of breast cancer. It will progress much more quickly. So getting the right treatment started was pivotal.
Let's talk about that. How did you decide to tackle that treatment path?
So one thing, Jill went through our full multidisciplinary process, as all of our patients do, where her pathology was reviewed by one of our breast pathologists. She had all of her outside imaging reviewed by one of our breast radiologists, and there were some additional pictures that we needed to take, as well as an MRI. And that's really where things blossomed, because we found a lot more disease than had been originally estimated, which definitely changed. We went to chemotherapy first, but it also changed her course for surgical treatment.
Jill, I want to ask, and I want to go back, because there's a fun aspect, a reunion aspect to this story, which we love. But at the end of the day, you were told you have cancer. That's a really devastating time. How did you handle that? What were you thinking at the time? I mean, somebody's going to be listening and watching, and they're going to go through this too. What was that like for you?
I really had no thought. Like, people keep asking me that. It was like there was no thought process. It was just, I need to start chemo. I need to start chemo. I need to get surgery. Once I started chemo, I was fine, because I was doing something. It was that waiting period that was terrible.
You wanted to fix it, though.
Yes.
What stage was it at the time?
I think that she was a stage 2.
And again, what does that mean? When we hear that a lot with cancer diagnosis,
right.
a stage.
And stage has become as personalized as the treatment plans, truly. staging, as I describe it to patients, is like a formula, like a mathematical formula. So it takes into consideration the type of cancer, what personality type, so what we refer to as the prognostic markers, the grade, how big it is as far as our understanding, which we estimate by imaging, if there's lymph nodes involved, and puts it into this formula based on how well, from historic data, we know that we can treat that cancer based on that date of diagnosis. And it was really the triple negative coupled with the ultimate size that made her a stage 2.
So you do the chemo first. What came next?
Surgery was next.
Surgery was next. And where do we stand today?
Well, Jill's a survivor. She's fortunately done with treatment.
Yes.
Had to have every modality that we offer, from chemotherapy to surgery followed by radiation. She successfully completed all of it, had a complete response as a result of her neoadjuvant chemotherapy, and she's doing phenomenally well.
Yeah.
How are you doing today? Just mentally, what's it like to know that this is part of the past?
That's great.
Great. That's
Yeah.
great. We have more questions and much more to talk about, so be sure to send in your questions on the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. So, were you much of a Chiefs fan? Have you always been?
If I'm gonna cheer for somebody, it's gonna be the Chiefs.
Okay, good answer, good answer. So I want to get to the good stuff, because Dr. Wagner, I want to talk, how did you conjure up this surprise? I know you are who you are, and you know a few people here and there, but this is a pretty big deal. So tell us how you came up with it, and then we're going to watch it again.
I would say a big aspect of this is we have a phenomenal partnership with the Kansas City Chiefs. They support our organization, our patients, and then you couple in the NFL's Crucial Catch initiative. Our marketing people actually approached me asking if there would be a patient, and I'm like, yeah, I have a pretty good idea of one. And so really just told them, she's the essence of what we do here. It's not necessarily her personal tie to me. It is her outcome based on her coming here. Being her own advocate. I know she said that she wasn't getting mammograms. There's a lot of women that are not getting mammograms that should be, but there's also been a lot of confusing information as far as what our historic recommendations had been from treatment organizations like our societies versus what the U.S. Preventative Services Task Force had said.
Clear that up for us then.
Yeah, so about 10, 11 years ago now, they had changed the date for starting screening mammograms really to age 50, and even doing it every other year. Fortunately, this past year, it has changed and now coincides with what all of our treating societies would recommend, which is starting at the age of 40. The other thing that we really want to advocate, and fortunately there's national legislation on this, is that women need to know their breast density. That's the other thing that is coupled in, which may make the world a little bit confusing when women are getting their mammogram reports, because they're going to see down at the bottom, you have dense breast tissue, talk to your provider about additional supplemental screening, and we want to be the partner and the support for patients getting that right screening.
Jill, did you know your breast density? You hadn't had a mammogram. Were they able to let you know?
From that mammogram, it was very dense.
So you're learning a lot since this diagnosis about breast health, and I want to get back to this fun surprise, because let's bring in Chris and Mike, because this was kind of cool. When you turned around and saw these guys standing behind you, what were you thinking?
It was pretty cool. They were huge.
I was gonna say, there's little Jill, little Jamie, and then here are these big dudes. I love it.
Yeah, they were huge.
And so they present you with these tickets to the Crucial Catch game. Just so thrilling, and you get to throw out the first pass. What was that like for the two of you to be? I think we have some video of you two down on the field at Arrowhead. What was that like? Just kind of, again, we talked about that full circle moment.
It was a full circle moment. The last time I was on that field was we cheered our freshman year in high school at the halftime game.
Stop it.
So it was pretty cool.
That is so thrilling. That is just so thrilling. I love it. Who is this guy? I was asking, do we know who this guy was in the video? We don't remember.
Oh, yeah. He's
just another big, tall guy.
No, he's one of our legacy Kansas City Chiefs.
Yeah.
He's what?
One of our legacy Kansas City Chiefs.
Okay, yeah. That's what we were saying. I was like, yeah, I know he's been around a while. So I was like, who's that guy? Okay, so there's the catch. You caught it. Thank goodness.
No doubt. You have no idea the pressure in my house for him to catch that.
We would have definitely had a do-over.
Yeah.
A do-over. Something cool that happened, though, Mike took a tour of the Cancer Center at Indian Creek, hung out. You guys were having fun, I could tell. But he was visiting staff and just checking out the facilities. Kind of what was his take on it?
It was really, I guess, interesting from my standpoint, because as Jill said, like, these two men walk in, they're huge. To meet these players and spend a little time with them, it's a little bit of like an awe-inspiring moment. One, because they're genuinely the sweetest two men. Their hearts are so big, but then to see what they do on the field, I absolutely love that they've got both sides. But to see his, I guess, true wonder and intrigue, and saying, I've always wanted to do this. I'm like, are you kidding me? Because I've always wanted to do, to meet a Kansas City defensive tackle and to be on the field. So just the fact that they have a world that is unknown that they think is equally, intriguing, I guess, was very humbling.
I think it was cool because you could tell in the video they were really plugged into this dynamic and this story and what Jill had gone through. They were also really, as they called you, Miss Jamie, and just thought it was so cool that this was happening, that you were able to go in and get that thing, as he said, get that cancer. I really could tell just in the video that they were really into it, the way that we always think about we're into them.
Yeah.
They were really into you guys, and I loved seeing that.
He was so cute. He said, I have one question I've always wanted to ask. And I'm like, oh, okay. Do you listen to music when you operate?
Yep.
And I'm like, oh, in my room, absolutely. I mean, it's whatever the surgeon's domain is, different things make us kind of click. And I said, but it's all about the tempo. And so then we actually talked about, one of our orthopedic surgeons has now asked me what my walk-up song is. So I also had to tell him, he goes, oh, I've got to know what your walk-up song is.
And it is?
It's actually a Taylor Swift song. Well, we refer to it as Vigilante, but it's about being very vigilant as a woman, and it's awesome. Like, it could not be a more empowering song for a female surgeon taking care of female patients.
I love that.
Yeah.
I love that so much. Jill, what's this experience meant to you? Taking it all in, from just reuniting with your friend to being on the Chiefs field.
It's been amazing. It's been humbling, and I'm really thankful I've gotten a chance to do it.
What's next for you two? Just staying in touch? You guys aren't going to let that much time go by again, huh?
Absolutely not. Yeah, we text all the time now, actually. Yeah.
I love that. I love that. I want to get to some questions from our viewers, if we can today. Stu wants to know, what are breast surgical oncologists like yourself taught in training today that they were not taught back in the day when you were in training? Not that was a long time ago, but what's the difference?
Oh, it's been longer than I think.
What is the difference? Why is it so specified?
Well, I think that the thing is, and maybe the better differentiation is, what is the difference between a breast surgical oncologist that's fellowship trained and historically where we received our training in general surgery and then you just parceled out part of your practice in breast. So there is a significant difference in fellowship training now, and that's the multidisciplinary training. So you have an additional, on average, 6 to 8 months of focused surgical training only in breast, learning all of the advanced techniques that we now do. Fortunately, we've advanced through research. Not every woman gets a mastectomy, and that's a great place where we are today. Some people do still need it, but we have advanced techniques for when we do lumpectomies, as well as when we do mastectomies. And there's no possible way, with how every field in surgery has advanced, that you're going to be able to learn those through a general surgery residency in the current era. But additionally, it's understanding how all of the parts weave together with the medical oncologist, the radiation oncologist, the psychiatric aspect of it, the survivorship, genetics, radiology, pathology. We truly get training in every one of those areas and more as part of that training.
Jeremy says he likes the term personality type for cancer specifics. Is triple negative its own thing, or are there further personality types within triple negative?
That's a great question, and there can be some nuances even within triple negative breast cancers.
Another question for you. How often does Dr. Wagner check social media? I would imagine a bit busy, so this sounds meant to be. Yeah, what's your social media
presence.
Yeah.
Non-existent.
Not a big TikToker, not a big Instagrammer, I take it.
And it's truly not that I am anti-social media. You know, I mean, I have all my family members, they just keep me updated, so I feel like it's one less thing I have to do. It's just more of, there's only so many hours a day and where I'm gonna put that. And also knowing that there's other people in my world that are also watching it. My mother is a wonderful social media person. She can tell me how many hits that video got, you know, things like that. So I still get the information. Yeah.
I love that. I love that. So, so you had said it was kind of a God thing that happened.
Absolutely.
Another question is, how often do second opinions really change a diagnosis and then a treatment plan?
So speaking specifically about breast cancer, there was a great study that looked at that very thing, and we do see that 43% of patients will have a change in their diagnosis and treatment if they have a second opinion at an NCI designated cancer center. And that comes to that previous question about what is the difference of a breast surgical oncologist? Well, it is because most commonly at those NCI designated cancer centers, everybody in the disciplines that treat breast cancer are specialty trained, and there's just nuances when that's the only thing that you do every day. We have even done our own pilot study here looking at what our changes have been. We saw that 27% of patients, when our pathologist reviewed their pathology, had a change in their pathology. That's the foundation of like the house of breast cancer treatment for us. On the other side, we saw between 38 and 40% of patients have a change in their breast imaging, whether it be an additional area or maybe a larger area, and that translated into a 41% change in the surgical recommendations. So that's like just getting us going. It is a meaningful difference if you have a second opinion.
When should someone younger than 40 get a mammogram?
Another great question. In general, we tend to have very dense breast tissue for the most part prior to the age of 40. It's really going to be based on your history, either your personal history or your family history. And we're talking more from a screening. Of course, if you feel something, you should be following up with your provider, but that's a diagnostic workup, a diagnostic mammogram. Screening mammogram is just when you're coming in for that quick overview. And the majority of the time, it is going to be directly tied to you having a family history or some type of a high-risk situation.
And just clarify, if you find a lump, you go to who? Just go to your regular doctor and then have them refer you to get to decide, or
most commonly, you'll go to your primary care, or you also might be going to your gynecologist, whoever you are tied into that can do a good breast exam to be able to help then direct you. At the end of the day, if you don't have anybody in that world, then you can always call. I know you can certainly call us anytime, and we have mechanisms. We have a great undiagnosed clinic with physician assistants who are part of our surgical team, and they can equally help that road of getting you in, get an exam, and get that right diagnostic workup.
Kim has a question with some big, big words in it.
Okay.
I'm passing this over to you. Okay, so Kim wants to know, what are the side effects from rituximab?
Rituximab.
You're the smart doctor. What are they?
Okay, there's a lot that can go into that. I'm not going to pass the buck on that, but like we could have probably an hour consultation about it.
Okay, what are those? What are those types of what?
There are different types of systemic therapies that we now can add, and you know, I would probably tell you to get Dr. Sharma or Dr. O'Day back on the show and talk about that. You would have an entire show about it.
Okay, because they can pronounce big words too?
Yeah.
Okay, yes, I love that. Okay, question, Amy wants to know what kind of radiation, so you got chemo, you had surgery, then you have radiation. What kind of radiation did Jill have? And then I'll ask you if there were any side effects to that.
Yeah.
But is there a type?
So there are. So as much as we have tailored the systemic therapy on some patients need chemotherapy, but not all do now, and how we can tailor that, we are heading into that realm for radiation, which is a really exciting place to be. We have a phenomenal clinical trial that is currently open, looking at can we stratify which patients will and will not need radiation. Mm-hmm. Another trial that just came out last December that indicated that based on response to chemotherapy, you might not need radiation. So a really great place to be of tailoring the radiation. But based on the extent of what Jill's cancer was at that time, Despite having a mastectomy, she also needed radiation. So we refer to it as post-mastectomy radiation therapy. And it was getting that entire field that the breast cancer had previously resided.
This has been such a fun Friday show. The best part of it is that you are cancer-free.
Right.
We love that part of this story. That's the best. As we wrap up today, what do you want the big takeaway to be from your story?
Second opinion and get those mammograms.
Those mammograms. Yep. Can't say it any better than that. Great advice.
Yeah.
Jamie, friend Jamie, Dr. Wagner, what do you want the big takeaway for folks watching today to be?
You're worth it. I think that I advocate a lot for everyone to know their body. You don't have to do self-exams like the old shower card days. It is just knowing what your body is, being comfortable with that, and if something changes, you are worth it to get the right opinion and seek that out. And if you don't feel comfortable, keep seeking until you are.
Great to have you two friends with us today. Thank you. Be well.
Thank you.
See you soon.
Thanks.
Have a great weekend. Thanks to our guests. Thanks to our viewers for being with us. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, the first and only Parkinson's treatment of its kind. Instead of pills with every meal, patients get medication pumped around the clock. I'm Jessica Lovell on the next Morning Medical Update, the continuous therapy making a difference for patients. Meet one woman who volunteered to test its effectiveness. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.